It really is a medical emergency. And the other thing I'll add also is that emergency rooms hyaluronidase do not have the ability to treat this. So
Mhm.
if it were to happen, you think, oh, I'll just go to the ER. They will not be able to help you. They do not have this kind of equipment or materials at all. This is Medspa Mayhem, the podcast all about the chaotic world of medical aesthetics. From Botox to lasers to IV bars, learn how to tell real versus fake, legal versus illegal, and safe versus potentially deadly. Hear the crazy stories inside the med spa world and find out what questions to ask and how to spot the people cutting corners. I'm your host, Dr. Kate D. Together, we explore the wild west of medicine that is the aesthetics industry. Hi, this is Dr. Kate D, and I am here with Paige Savage and Hannah West. They are two physician assistants in my office at Glow Medspa, and we are here to talk about vascular occlusion and an event that happened recently in the spa. It was the first time in 10 years, and I thought this would be a really great educational moment so that we can explain exactly what they are, what we have set up so that we can treat it, and then what happens if you go to someone who is not prepared to treat a vascular occlusion. So, hey, Paige and Hannah, thanks so much for being here today.
Anytime.
Yeah, thank you for having us.
So, why don't you guys introduce yourselves?
I'm Hannah West. I'm a PA, as Dr. D mentioned. I've worked here at Glow for about 3 years and done aesthetics full-time during that time. Prior to that, most of my experience was in the neurology space, specializing in headaches. So we use Botox for that, interestingly. Nerve blocks, things of that nature, which lent itself well to this. Love working for Glow and Dr. D. Yeah, that's me.
And Paige?
Yeah, my name is Paige Savage. I'm a physician assistant. I've been working at Glow for about 1.5 years now. I've been working in aesthetics for 4 years now. Before that, I worked in primary care. Yeah, I love working at Glow.
Thanks, guys, so much. I really appreciate your willingness to talk about this for the podcast. As I've been trying to educate the public of like why it matters where you go. One of you want to take on what is a vascular occlusion and why we worry about it?
Sure, I can do that. So oftentimes you'll hear us shorthand call it a VO, vascular occlusion. So if you hear VO, that's what we're talking about. Vascular obviously refers to a blood vessel. Occlusion means to block or occlude. So when we are injecting fillers, most of them are a gel. So it's a solid material. And when we're injecting it, if you get really unlucky and a little bit of that gel filler gets inside of a blood vessel and blocked it, that could mean you don't have downstream blood flow like you're supposed to. So if that were not restored, that could mean you have permanent loss of blood flow somewhere, which could result in permanent scarring, tissue damage. It can be really disfiguring. So when we say vascular occlusion, that's what we mean. Another word that you'll hear us say in regard to that is like perfusion. That means like blood flow getting to the tissue. So if you hear that later today, that's what that means. So essentially, we want to avoid that at all costs. And it is why we only use fillers that are dissolvable. This is specifically talking about hyaluronic acid fillers or HA fillers. Those are the most common type, but those are the ones that are reversible.
And we've talked about this on the podcast before. There are non-reversible fillers that are FDA approved in the United States. So it's not illegal to use them. It's just way more dangerous. And we don't have them at Glow because I wouldn't be able to sleep at night knowing that those were being thrown around. You can imagine if you took a gel that wasn't dissolvable and you stuck it in a blood vessel and it blocked it and you then couldn't treat it, then you watch this unfold and you would lose skin or tissue and it could be quite disfiguring. So we only have dissolvable fillers and there's a lot of different ones of those. We have kind of two families of fillers, Restylane, which is made by Galderma, and Juvederm, which is made by Allergan. And there's lots of fillers that are in those categories. But there's other brands as well. So what are some of the other things that we have that basically were set up to deal with it, to minimize the risk in the first place, right? And then to deal with it if it did happen. So one thing that we do is we have a whole kit in the office in case we need it. The components of that kit, so God forbid there's a vascular occlusion, we have a whole bunch of enzyme in the refrigerator called hyaluronidase that is used to break down hyaluronic acid. And we have piles and piles of that. Do you guys know how many vials we have at the moment?
Last I counted, I think we had 18 or something, but we always try to have at least 16 on hand. Usually the recommended upper limit for what you would inject into somebody's face in a setting is like about 15 vials. So that's your like tried and true in an emergency. You need to have this much.
So I think our policy is to make sure we always have at least 16 vials. Yeah. We also have aspirin in that kit, packs to dilate blood vessels. And I also have an ultrasound machine, which we didn't really need for this particular treatment, but we could have used. But since I am a former happily retired radiologist, I find ultrasound really handy. I really like it. Luckily, we don't need it very often. But if there's ever any question about vascular anatomy, we could whip that out and take a look. And if there's ever any question of occlusion and you're not sure where, you're trying to find where to inject, you can use the ultrasound to help you do that. So what about cannulas? Do you want to explain, Paige, like the use of cannulas and whether or not that actually helps avoid the risk of vascular occlusion?
Yes, the cannula is the way I describe to patients is it's like a blunt tipped needle. So it looks like a very long needle, but it's not sharp. And if you use a cannula that is large enough, it's called the gauge. The size of the cannula is called the gauge of the cannula. And if you use a cannula that's large enough, it should really just push past the vessels in the tissue rather than going through them, puncturing the vessel. So that can make a vascular occlusion a little bit less likely to happen. A lot of times when we can, we will use a cannula. I do still occasionally use needles, but I think that we here at Glow implement cannulas pretty often, especially if we're injecting in areas that are considered higher risk for a vascular occlusion.
Yeah, definitely. I agree. We have an AccuVein that allows us to identify veins under the skin. We use that for injectables as well. I don't think that really makes a difference for vascular occlusion. So it really helps to reduce bruising because you're avoiding the little superficial blood vessels right under the skin. But when we're talking about a vascular occlusion, we're really worried about an artery getting filler in it. And arteries are deeper, and we can't really see the arteries with the AccuVein. Although AccuVein's great and really helps to avoid the superficial blood vessels, usually we're worried about deeper ones that you can't actually see with that. But it is nice to have. And it also is nice to have to avoid bruising because sometimes bruising can be confused with vascular occlusion. So it is helpful to be able to minimize your risk of bruising just to minimize that risk of confusion.
I do think it's good to point out too, the most widely recognized reason why we think an occlusion happens is like needle or tool goes into vessel, filler goes into vessel. But there's also some theories about filler just compressing on top of a vessel in like a tight anatomical space that doesn't have a lot of room for product. And there's also some discussion about just some of the little arteries spasming in connection with filler being injected near it. While the cannula still is safer, there's still a decent amount we don't know about occlusions, and it still doesn't mean you cannot get one when you are using a cannula. Safer
Right.
doesn't negate it totally.
So besides all these tools and the enzyme and the kit, we also routinely update our protocols for treating an occlusion. We go over those protocols pretty regularly and we check with each other. And we have a team of people to help and make sure that that we know what we're doing and that we help each other out. The other thing is I also have 2 facial plastic surgeons who I've developed a pretty good relationship with so that if we were to need somebody like that, we have a connection and that's really important. And they have access, at least the one who's closest to our clinic, he has access to hyperbaric oxygen if we really needed to refer somebody for that if the occlusion wasn't fully treated or we had some problem. So we do have backup. So that's also really important. So I've talked to other injectors on the podcast about vascular occlusions are appropriately very rare, but they do happen. And it's basically a risk that you can't just make go away. If you do enough of it long enough, you will eventually see a vascular occlusion. And so I'm happy to say that we went 10 years before we saw one at Glow. Actually, that's not true. We had 2 different ones walk into our clinic who had been treated elsewhere. And one of those we treated, and then the other one, that dermatologist who had that complication, she treated that, and that patient, as far as I know, did fine. But this is the first one that we've seen that actually happened at Glow. Can you guys just go through what happened, what did you do, and how it all panned out?
Yeah, so this was actually a patient that I was seeing. This is Paige. So I was seeing this patient at the end of my day. So it was the last patient of the day, thankfully, because this would have been very hectic if it happened in the middle of the day. But it was the last patient of the day, and we were injecting filler. It was Restylane Contour into this patient's lower face. And I was using a combination of needle and cannula. And I do not know exactly when the vascular occlusion happened. There wasn't a particular point in time when I looked at the patient and was like, that's definitely a vascular occlusion. It happened very slowly. I started to notice that the patient's tissue was no longer looking normal to me. It looked like it was a little bit discolored. And yeah, so it looked like something called levato reticularis, which is like this lacy, dark discoloration. And what I did at that point was I started injecting some Hylenex. So the Hylenex is the brand name for hyaluronidase, the enzyme that dissolves the filler. So I injected some, and then I went and grabbed Hannah. So Hannah was next door seeing another patient, and I wanted to get her opinion. So that's when Hannah popped in.
Yeah, Paige came over very calm and collected. I assumed she was going to ask me to look at like a rash or something. Lo and behold, it was like the thing that we're almost afraid of. But right away, she was like, do you also think this tissue looks odd to you? And I could tell pretty immediately that it did. So one thing that we test when we're looking at the blood flow in an area is called capillary refill or cap refill, which is just how quickly when you put pressure over your skin and then release it, the blood flow comes back and it starts to get pink again. And I could tell immediately that it was delayed. And it's one of those things, it can be a little vague, but if you check that on every patient that you see pre and post filler, your brain does start to figure out what is normal. And pretty quickly we could tell that was delayed, which is a sign that there's a blockage there.
Sure. And let's just add in that if you completely block blood flow to an area of skin, it will just be white and it won't be getting any blood flow. So if it's partially blocked, when you push on the skin and it goes white, it blanches, and then it pinks up again. And so if it's fully open, it should pink up very quickly. And so if it's partly blocked, or if there's multiple branches of an artery feeding one area and one of those is blocked, then it will be sluggish. So sounds like it was delayed, meaning sluggish capillary refill. And so what'd you guys do next?
So the established protocol involves we inject that hyaluronidase enzyme, certain quantities of it. You can mix it with saline, sometimes lidocaine, depends on a bunch of different things, but we did employ those. Essentially, you're just running through this, inject the hyaluronidase, apply heat to dilate the vessels, massage the area to disperse it all, and hopefully encourage those to open back up. And then we're just reassessing it. So continuing to check how quickly that blood flow was coming back. And essentially every hour we did that until it was a total in the end of about 15 vials. I think we probably could have stopped sooner, but we wanted to really make sure that it was finished. And I'll let Paige pick up after I say this last part. But the more you inject in there, the tissue gets really swollen. It's appearing bruised, which, as Dr. D mentioned earlier, can be confused with that lack of blood flow appearance. It does start to get a little difficult to tell exactly what you're looking at. So it was so nice that both of us were there, both for moral support and to just have a second set of eyes on it. Do you want to add to that, Paige?
Yeah, so it was really great that Hannah was there, both in the beginning when I just wanted to hear what she thought about the patient's tissue and how it was looking, but also just to help throughout the situation. She helped to go grab heat packs. I was doing injecting and massaging. At some point, she even went and grabbed Pronox, laughing gas, and the patient was using that. And I believe
And that
Henry
has been
found
shown, besides to calm the patient down, that's been shown to actually increase blood flow or open up blood flow sometimes. There's some evidence that's helpful.
We figured it couldn't hurt. And truly, the
really
patient,
can't hurt.
yeah, the patient was a champ. She was
Right.
actually handling it great, but it does also help reduce discomfort and anxiety. So that was, I think, another plus.
And I
Yeah,
think
so
you guys called me sometime in about
Mhm.
half an hour into this.
Yep.
I was not in the office at the time. And by the time you called me, it sounded like it was improving. It wasn't all the way better. I didn't need to come in. I don't think that I would have done anything different than you all did. But what I did do was text my facial plastic surgeon friend and just let him know that we had this going on and make sure he was around and knew about it and had access to the hyperbaric oxygen in case we needed it. I was really happy to update him later and to let him know we did not need his services. But so how did it all look by the time you had all those vials of Hylenex in there?
yeah, so again, at that point, it was difficult to fully assess the patient because there was a lot of swelling. She was bruised. But before, maybe like an hour before we finished injecting the Hylenex, we thought that the capillary refill had already started to look improved. But we just kept going to be extra safe and cautious. So what we were looking at the end was a faster capillary refill. It was less than 3 seconds.
And the patient could get a hold of us all evening. We had a plan for her to follow up the next morning to look at things. We told her the flags she should be looking out for and what to expect. Thankfully, she is a healthcare provider as well. It is actually pretty well versed in like head, neck, face anatomy based on what she does. So she was also somebody that had a good head on her shoulders already to deal with something like this. Yeah, so it looked pretty good at the end of the night. But we were there until 10 p.m. We had to go next door. We got dinner for everybody. We all ate eggplant parm while Paige and I stressed out and tried to make our patient as comfortable as possible.
Yeah. So luckily we do have a really pretty decent Italian fast casual place next door.
Okay.
And then Paige and I saw the patient the next morning. She looked great by then. Her refill totally normal in the morning. She seemed pretty calm about it. She wasn't unhappy. Maybe felt like maybe we were overdoing a little bit. um, but I think that it went exactly as it should have gone. And so hopefully maybe we'll make it another 10 years before this happens again. I really wanted to talk about what happens if we're not prepared, right? The places that are using non-dissolvable filler, obviously none of this stuff would really work. There are some things that can dilate blood vessels, but if they're really clogged up with a filler that's not dissolvable, it's not going anywhere. It's like putting concrete into your sewage pipe. It's going to be backed up. The other thing is that we had a case on this lovely woman, Krista Carson, who calls herself Disfigured Beauty. She was on the podcast a while back. And she had a non-dissolvable filler, but also had a provider who had no supplies in his office. He really didn't know what to do. So he didn't have the hyaluronidase. He didn't have ultrasound. He didn't have anything basically. And she ended up being scarred and losing a big piece of her nose. And it really is a medical emergency. And the other thing I'll add also is that in general, emergency rooms hyaluronidase do not have the ability to treat this. So if it were to happen, you think, oh, I'll just go to the ER. They will not be able to help you. They do not have this kind of equipment or materials at all. As a matter of fact, I interviewed an ER doc about ER complications from med spas. And she was like, yeah, we would end up calling you and saying, you got to treat this person. Really important to make sure that you ask those questions before you have any kind of filler. What kind of filler is it? Is it dissolvable? Have you guys ever had an occlusion? And if so, did you treat it successfully? Do you have all the supplies that you need? Is there anything else you would ask? Anything you would recommend patients ask their provider before they go forward with filler?
I think it's probably a good idea to have some semblance of what kind of support does this person injecting it have. So Paige and I were there together, which was great. We have a supervising physician that is nearby, always available, has a go-to. As Dr. D mentioned, we have a network of people that we could refer to if we ever had to escalate care. And just making sure they tell you about that risk. If you should ask it now, but I am often surprised by the number of patients that I will treat with filler for the first time here, but they've had it elsewhere. And they are totally surprised to learn about this scary risk. And I try to say it in a way that doesn't sound terrifying, but it is a real medical complication that can happen. And you really got to know about that stuff. It's mind blowing to me how often it's swept under the rug or just hidden in the last little fine print sentence of a consent form, but not said verbally to patients.
Yeah. And then also just making sure that they have some hyaluronidase in their office that they can use if there is a problem. And I guess also asking about who the patient can reach out to if they notice a problem. Is there some contact information? If the patient reaches out, are they just not going to be, is the office just not going to get back to them until a day or two? So yeah, contact info too, and just confidence that someone will respond to you if you have any issues.
Mm-hmm.
Yeah, and I totally agree with all of that. I think that when I first started doing this 10 years ago, this was my number one concern. I'm like, I can't do this unless I know it's safe. And I also, maybe one other thing is talk about the alternatives as well. So when we talk about informed consent, we cover the benefits, the risks, and the alternatives of every procedure. And it might be that you don't need filler. There are a lot of places where that's all they do. They do Botox and filler. That's what they offer. They don't offer laser procedures. They don't offer skin tightening or RF microneedling or any of the other things. And it might be that you're a way better candidate for something else. I think that might be something else to ask about is what other stuff do you do here and what are my options? Is there anything else you want to leave our audience with other than don't be too scared? But definitely if filler is in your future, whether it's I would say the vast majority of the filler we do is probably lips and cheeks. Would you guys agree?
I think that's probably the most common. Yep.
Yeah, I think that's accurate.
And those are honestly like safer in general than other areas. The big disaster that is really nasolabial fold that can be quite dangerous, even though that's really common. People put filler there. But I would say it's really safe in very competent hands. If you go to somebody who knows what they're doing, who's practicing safe technique, and who's prepared to treat any kind of emergency, then I think it's totally fine to do. I'm not anti-filler. I just feel like people really need to understand what they're getting into when they have it. So thank you guys so much for talking about this today. I appreciate your time. And maybe I can convince one of you or both to come back and talk about something way more fun in the future.
Yeah, I'm stressed out. I'm sweating a little again. To relive, we called it our trauma bonding evening.
It was.
Yeah, but you guys are so talented and you really took care of it. And I so appreciate how much effort you put into that. And I just I find it just extraordinarily valuable to have you on my team.
Thank you. And we appreciate that you've set us up for success here. So
yeah,
props all around.
All right. Thanks, guys. We'll have a great night.
Thank you. Have a good night. Bye.
If you've learned something and like what we're doing, please tell your friends and give us a 5-star rating in your podcast app. If you have a question or a crazy story of your own you'd like to share, please send an email or voice recording to info@drkatedee.com. That's drkatedee.com. Or reach us through the website medspamayhem.com. And read the book. Medspa Mayhem is available everywhere books are sold. Thanks for listening. I hope this episode has been helpful. Most injectors will not talk about this subject at all. Most are underprepared to deal with it, and many don't even know the facial anatomy that they're injecting into. I thought it would be important to shed light on just what this, thankfully rare complication can entail. Thanks for being here. This has been Medspa Mayhem with Dr. Kate D. We are so grateful you're listening, and we hope you've learned at least one fun or possibly disturbing fact today. Don't forget to hit subscribe on your podcast app and leave us a 5-star review. And read the book. Medspa Mayhem is available everywhere books are sold. Links and more can be found in the show notes and on medspamayhem.com.